You said that health outcomes can improve 40% when the doctor and the nurse are in the same room at the same time. Could you also give us a sense of like the economic cost of what are the implications economically for a hospital with trying to coordinate all these different providers with the patients and their families?
Yeah, so there's really three main areas that we are going to see an impact on ROI. So one is that error reduction, malpractice claims, things that are all upstream related to communication. When we don't get the people in the room talking, we make errors. And so we see error reduction. Those are costly both in a physical sense. It's a major cause of death in the United States is medical errors in a hospital system. And they're hard dollars when that actually manifests into lawsuits for hospitals and having to undo the mistake that's been made with other healthcare decisions. So one is that error reduction we're able to see. Two is length of stay. When we identify barriers to discharge, when we have the family present saying, okay, this is what we need to go home, and they're on the same page, we can get patients out of the hospital to their homes faster and make it less likely that they have to bounce back to the hospital because they actually understood the plan because you weren't relying on the sick patient to be the message giver of how they're going to be cared for. You had the family present throughout that discussion. So we can see beds turnover faster as well as less likely to be readmitted. And then there's patient engagement. This is not just, the patient experience is not just a nice to have. There are dollars that are withheld for top box scores and patient experience. One of those survey questions is, did my doctor update me every day? We get that to 100%. And those dollars get recouped by hospitals. But there's also just market effects. If I'm at a hospital that shows me the dignity that they are going to include my family and tell me when the same dignity that Domino's is giving me, we're going to give from the healthcare team, that is a competitive advantage in the healthcare space. So that leads to revenue there. That's just kind of the big three we talk about. We're seeing things around nurse engagement. Nurses are telling us that the doctors are learning their names for the first time because nurses get notified to be automatically included in rounds. And the doctor's able to see, oh, Mia is on her way, as opposed to hoping the name tag is facing the right way. So just that sense of community in healthcare, of us working as a team, we're seeing benefits in there, and we expect that to manifest as lower turnover and increased retention in that competitive nursing landscape.
That's incredible. Just the level of dignity that Domino's shows us.